Counselor Lay, would you please give us an invitation?
Yes, ma'am. Thank you. Dear Lord, we appreciate coming together today to do business for the Cherokee people. We appreciate everything you do for us every day. In Jesus' name we pray. Amen.
Amen.
Connie. Mike Dobbins. Here. Jill England. Keith Austin. Charlie Bezzard. Joe Bird.
Honey.
Sean Crittenden.
Honey.
Shannon Duncan.
Honey.
Wanda Hatfield. Honey. Terrence Jordan.
Here.
Dick White.
Honey.
Mike Shambaugh.
Here.
Leo Smith.
Here.
Denise Taylor. Here. Victoria Vasquez. David Walkenstein. Brian Warner.
Honey.
We do have a quorum.
Thank you. Has everyone had an opportunity to read the minutes?
Second.
Motion been made to approve and seconded. All those in favor say aye.
Aye.
Okay, thank you. First report, thermal service unit. Good afternoon.
Good afternoon.
You should have my report there in your packet. A couple of things I wanted to go over with you, share with you. We had 160 visits in audiology for the month of January. Dental, we saw 1,020 patients. Our diabetes group did 187 educations. Pharmacy filled 30,180 outpatient scripts and mailed out 9,690. Physical therapy had 202 outpatient visits and 29 inpatient visits. And in radiology, we did 2,351 exams there. So I just wanted to share that with you as far as productivity. Any questions?
Does anybody have any questions? Yes, Counselor Dobbins.
George, how many dentists do you have and how many dental hygienists do you have on staff?
Two hygienists and 7 dentists. 6 or 7.
Any specialists?
No.
Just all general dentists? 7 and 2.
Yes. We do have one, I'm sorry, we do have one pediatric dentist.
Yes, Counselor Buzzard.
You probably had in your report last month, George, but on the ortho, did you get a contract in Tulsa?
Yes,
now?
yes, sir.
It is in Tulsa?
Yes.
And who's it with in Tulsa?
I didn't get that part. I'll check. I can't remember right off the top of my head.
That's all right, I'm just curious, but yeah, okay, great.
Any other questions? I personally want to say thank you. You took my call the other day, and I appreciated that so much. Thank you.
Thank you, I'm working on that.
Thank you so much for that. I'm grateful. Counselor Crittenden, did you have a question?
No, ma'am.
Okay. Shambo? Did you have one?
I was waving at the last question.
Y'all waving, I'm gonna call on you. Anybody else? Thank you so much for
Thank
the
you.
report. We appreciate it. Dr. Jones. Good afternoon to you as well.
Good afternoon. Thanks for having me. All right. I think you have a copy of the report there in your packets. I'll call a couple of things to your attention as we go through it. If you'll look on page 3, it shows that currently our contract health approval rate's at 96.7%. And you'll also see a graph there that shows currently at our current rate, which we're working through, that we're going to be approximately 15 million over budget. So just to make you aware of that as we work through and all these approvals and we get closer to that 100% approval, of course, we spend money to do that. So that number started out around 20-something million over budget projected at the first of the year, and we got it down to 15, and we're still working through that. I think the latest number I saw was around 12. This is a month behind, so we are working through that. Just want you to be aware of that. That's always an issue that you guys ask about, and that's why we put that graph on there, so you can see where our current process is on that. Numbers came back up for February, as you can see on the service delivery on the next to last page. And then you had asked for a diagnosis by clinic. So that last page gives you the top 3 diagnoses at every clinic. The only one that's different is Gadugi, which is just an acute care clinic for our employees. So you can see that those diagnoses are a little bit different. Everybody else consistently is hypertension, diabetes as our 1 and 2. And then someone asked last time about our flu numbers, so I had some numbers here for you that I just wrote down. For January, we had 14, and we're in the middle of flu season, of course, and it's peaking now. In January, we had 14 people admitted to the hospital for flu, and 424 tested positive across our system. In February, that number jumped up to 29 admitted in the hospital, and 1,355 tested positive across our clinics. So we are in the midst of the peak of flu season, so just to let you know kind of where we're at on those. From there, I'll take questions if you have any questions for me.
Councilor Crittenden?
Doctor, when we can't get a hold of you, who's 2 or 3 names that we could email and may get a response from?
I'd say get a hold of Taryn, and of course I will respond as quickly as I can, and I'll delegate those questions out to whoever needs to get the information if I can't get it back to you. But I can't always answer my phone when we're in meetings or when we're at, if I have somebody in my office or something like that, or if I'm out, because I don't like people to have to be on their phones whenever I'm conducting a meeting, so I don't get on my phone when I'm in someone else's meeting.
So Taryn would be the...
She's supposed to be the liaison between this body and our services, so that would be your best bet to get with her, and she can. And I will respond. It just may take me a little bit to get back to you.
We'll just every now and then, and I hope you think I don't pester you too much. Every now and then there's a time we need an answer for our constituents, faster than 3 or 4 hours. And, in the past, I had 2 or 3 people I could reach out to, and,
Communicate.
I hope everyone here, sometime there's some things that come up that we just need an answer to get to our constituents and be done with it. And I don't think I'm the only one that feels that way. And I'm sure I respect what you do. I love the reports that you're doing. And but I think there's a group of people here that can say that we get lots and lots of calls and emails and text as well, and very rarely is it 3 or 4 hours later that I contact someone. So if you can think of another name or 2 that I'm not there to boss anybody around, but I would like to think that someone in a high position, in medicine, and there's some staff here that would attest I'm pretty polite and courteous, and just if questions can't be answered, some can't, and I understand that, but there's just situations when I need an answer for no other reason than to convey that to my folks. So if you have in mind, you can privately email me another name or 2, and I'd appreciate it.
And we try to get back ASAP on anything that has to do with the patient or patient safety issue, obviously. But there's a lot of you asking for a lot of questions, and so I try to distribute that out so that we don't have one person pulling away from their daily job of whatever they're needing to do to answer these questions. So I try to, when they come to me, whoever's the expert in that area, I send it to them to try to get me the answer as quick as I can to get it back to you.
Right.
So we want to make sure the information you're getting is accurate also, and not just someone's view or someone's opinion of what's actually happening. So we try to get that back to you as quickly and as accurately as we can.
All right. Appreciate you. Maybe looking for another name or 2.
Speaker Byrd.
Yes. One of the ways you might do that, Counselor, is our legislation, our policy has the chairmen of committees. I usually have an issue in resources or community, I'll go to the chairperson first. If I can't get an answer, she's the chair of the health, and just email and say, I need an answer for this. And then also CC Dr. Jones, and one of them should respond.
Well, I emailed him, and I think she was in on the email as well as Brian and Kanan and Joe Crittenden and a bunch of them, and it just, like I said, I respect anybody that's busy, but
Sure.
but I needed a particular answer that day and got it about 4 hours later. And some of the folks here and listening were trying to help me get that answer.
Absolutely. The chair of a committee should be able to get an answer pretty quick. I mean, that's the way our system is set up. It's like if I want an answer from one of the department, and if I can't get an answer about career service from Diane Kelly, then we're hurting. That means we're not too transparent around here, and we're not communicating very well. But that's the way our system is set up. The chair of a committee should be able to get an answer pretty quick.
All right.
Thank you.
I do want to say this, you know, Dr. Jones is dealing with people who are dealing with life and death situations at times. And I can understand that his time is, he's got to prioritize it. So, you know, if we ever need another backup name, I probably have a couple as chair of the committee, and I would be happy to share.
Yeah, share those with me.
Yes, I will. Be happy to do
I
that.
had one more comment.
Sure.
We did some visits some time ago to Baylor University, and we had the chair of a health went, and Councilor Warner, Secretary of State went also. And every time I see one of our tribal members that's going through an amputee situation, it just comes back to me, are we doing enough for our people? And I know we talked about not enough data, not enough research, but I'd like to revisit that. I'd like for you to go back and revisit and say, how do we make this work, or if it's doable? Because the cost of doing an amputee versus what we saw at Baylor University just makes me want to make an attempt at it. Every time I see one of our tribal members hurting and have part of their limb gone. So if you would, I'd like for you to revisit that, sir.
And I'll get Dr. Montgomery involved. He's a lot more astute in that area than I am, for sure.
Okay. All right, appreciate it. Thank you, sir. Thank you,
You
Madam
know,
Chair.
I would like to chime in here with Speaker Byrd. You know, perhaps a lunch meeting or something where we can share what happened at Baylor and the information that was shared with us, and see if we can't carry that forward with the opening of the new clinic as a consideration, especially with the physician recruitment division. So would you all agree, those that attended?
It was awesome, care that we saw there. It's
Yes.
just at the highest level. They brought out all of their high-level management people there, chief financial officer, their CEOs. They brought everybody out. I mean, it was first class, and what they demonstrated to us was just something that gave me hope for our people. And I just think we need to go back and maybe take a look at that. I think there was even a proposal for some type of MOA, MOU that you might revisit and see if does that affect any of our current agreements we have with other institutions right now? If it doesn't, then if there's no cost there, maybe we can look into that as well.
Okay, we'll look into it.
Okay, thank you, Madam Chair.
Okay, Counselor Lay, did you have a question?
Thank you, Madam Chair. Doc, you mentioned we're in arrears on, go through what you started off on when you first sit down and speak about we're I think you said $12 million behind. What was that the referrals out, or what?
Yes, that's in contract health. We obligate, whenever we do a referral, there's money obligated for that service. Okay, but we're the payer of last resort. So if that person has Medicare, Medicaid, third-party insurance, any of those things, then those monies all pay first, and then we pay what's left on those. So what we obligate is the full amount, but we reconcile that in the arrears. Does that make sense? We have, if it's $100, we're going to obligate the full $100 to that contract, and then after everybody's paid, we may only owe $25. So that gets reconciled in the back end. That's why that number tends to come down as the year goes on, because we're reconciling those accounts. But in the beginning, as we obligate them, we have to obligate the full amount, because we have to assume that we're going to have to pay the full amount. But then we go through our processes and we get that written down.
So at this time, we're not actually in arrears then?
We're not actually in that, that's the projected amount. So
You're
it-
referring to the accounting cycle that
Mhm.
takes us down to the end of the year.
Right. And so as it works down, that number starts out very large and it starts to work down as the year goes by. But in the beginning, everybody's meeting deductibles, things of that nature, so a lot of those things that are obligated, we pay a higher percentage of because somebody's deductible applies to that and we don't charge that back, and that just comes off what we pay.
So are we utilizing 5% in any of that?
Absolutely.
Okay, thank you.
Okay, Counselor Shambaugh.
I had a young lady come to me the other day, said she had got in the LPN program at a VOTEC, wanted to have a career, possibly move up to be a nurse and different things. She said she couldn't find a job because she was talking about, apparently there's some type of point system where the younger people, I guess, that were coming out of high school were taking more classes before they went. When they got out of class, they're given points for whatever I guess for graduating. Whatever the classes you take, you get more points for what you do. She said she could not get hired anywhere because all the of the younger people who were taking more classes and getting more points. She has since moved on and got a different kind of job, but she was just wondering if there was anything that could be done. Maybe, when these people get out of VOTEC and they don't have the points that the other people have, is there any type of way that they could be looked at to have maybe preferential treatment where they could have a chance to maybe try to get a job? I'm not that familiar with it, but that she was trying to explain all this to me. But she said all the younger people had more points. She had started a little later in life and didn't have those points and wasn't looked at in the same light as the people with more points on the point system. Are you aware of that? I mean, I probably should have asked you this before, so you could have checked in this, but I just didn't have time. I apologize for that. But
I'm not aware of anything like that. It could be the way those degrees are done, because I know the LPN degree comes through Connors University also. They can go to a LPN. I'm not sure how that fits in comparison to a VOTEC program. I don't really know that, but I can check into it and see. I don't know of any kind of point system that we put in place whenever someone applies for a job. We don't have a point criteria that gets them on the panel or off the panel. It's either you have those certifications and those requirements for that job, or you don't, and that gets you on the panel or maybe not to the hiring manager if you don't have those or whatever's requested in that job when it's posted.
okay. And I have one more quick question.
Sure.
I had another person come up to me several months ago, and I just kind of had forgot about it, but they were talking about open wound care on some diabetic stuff, some issues. They said currently our hospital now does not have a specialist for open wound care. They were wondering if, I guess they had to go to Claremore and see an open wound specialist in Claremore. Said we didn't have one here. Do you know if we're going to have anything like that for our diabetic patients at our new clinic?
I know we have a wound care department, and that we see, we do wound care there at the hospital. I'm not sure about having a specialist. I know there are some cases where it's beyond the ability of our people, and we do contract those out.
What she said, that the wound care that she had gotten here was basically you cover it up, you put stuff on it, and you kept it covered. Said it was totally different from the wound care she received at another hospital, whereas they
Debrided.
raped it and they did some things that said it was very painful, but in the end helped her out very much so. But said here it was basically a covered up and ointment and try to heal it that way. But it was, I guess they were just a lot more proactive in this other place that she went. Do we have anything maybe at our new hospital that may be more like that?
Not that I'm aware of that's a specialty in that area. Usually our surgeons are involved when it comes to debridement and things of that nature. So, and that's, those people are on staff already at our hospital. So it just may be a difference in the philosophy of the treatment that was required at the time, or what they, diagnosed whenever she went there. There's also an effort to also keep those patients closer to home. if there is a transportation issue or something like that. So that may have been why the referral happened also.
Okay, all right, thank you.
Counselor Buzzard?
Dr. Jones, I have a couple of questions.
Sure.
And I don't know, it seemed to me like this person wrote everybody on the council a letter about dental appointments. And I know we've gone over this before, and if I can remember right, I didn't bring a letter with me that Hastings dental appointments start calling in at 4:30 to make the appointment. Well, the letter said he'd called for 2 weeks straight and couldn't get in. Couldn't get anybody to answer the phone. And I thought about, well, how do you fix it? I don't know. Couldn't somebody answer the phone, or what is it telling us?
Yeah, they're supposed to answer the phone.
Well, that's kind of what I thought, yeah.
But we do have.
I think he wrote everybody a letter. I didn't bring the letter with me.
Typically, we do have a certain time that people call in, and we give those appointments away 30 days out. And it depends on how many docs are going to be in the clinic, whatever clinic they're calling, on how many appointments are available, because we require every provider to see 4 new patients per day. Okay, so so there's only a limited amount due. We've tried a lot of different programs to try to eliminate that. The demand is higher than the supply.
And I know that. We've gone over this before. It sounded to me like his most frustration was nobody called him back and nobody answered the phone. So
Yeah.
if we could take care of that, that would take care of the problem. I'm
And
sure.
typically, if we find someone who has repeatedly called, just hasn't by chance, most people will get in 2 to 3 days. They'll get their appointment and go. But every once in a while, we get that person that just by chance has not been able to get through, and we usually help try to facilitate that. So I know
Well, I
that
think
people have contacted me, and when we hear that, we assign it to someone to call them back and talk with them, see what process they've been going through, see if there's something we can do to help them get in to get seen.
Well, if we check on it and see.
Yeah,
it.
and that's-
I think his frustration was nobody answered the phone.
And that's typical for brand new patients for comprehensive care. As far as routine care is from a urgent care standpoint, if they have an emergency or they have a toothache, something that if they need immediate treatment, that we treat those every day. You just come in and we will see you that day. You will not be turned away. But the comprehensive care part of it is the part where we take those phone calls. It's not for something where they're having that problem right now.
Well, I just think he was pretty frustrated because he never could talk to anybody.
Yeah.
Anyway, the other thing is, and I'm still concerned about this. I think when Dr. Grimm was here, he mentioned the fact that we or you or the nation had to hire so many employees by a certain day to get into the new clinic, they draw money down. Has that begun to happen to hire new employees?
We don't have any money to draw down on it, but we have identified certain positions that need to be hired earlier than our actual start date, so we can get them on board and get them started and get things. So we've got a list, and it's of anticipated hires, the ones that are going to take a little longer. They're going to take a little more recruitment to hire, so we're working through those now. We have a 6 month out, a 3 month out list that we're working through.
Well, that's good assurance.
Yeah.
The other thing is, I'm curious to know about is, and this is pretty common knowledge around some of the clinics, and maybe not all the clinics, but sometimes when providers are hired, word gets out that, well, you don't have to see 18 patients a day, you only have to see 12 patients a day, or 23 patients, whatever that number is. I'm wondering, since the RVU system is in place, if a provider is told you've got to see 16 patients a day, how many providers now are starting to collect on the RVU system? Do you have it? You may not have had a chance to look at that, but I'm curious to see if the numbers say, well, you only have to see 16 patients a day, how many of our providers are going over and getting the RVUs? I'm just curious. But sometimes, a patient can go in, the doctor may not have to see him over 6 or 8 minutes just to see how they are, see another patient. But I'm just curious to see if we're starting to pay out very much RVUs. If you would check on that and let me know, or let us know.
We had more this quarter than we had before,
So it's starting to pick up some.
It does pick up some, but it's not because we require a certain amount to be seen, and each procedure or each patient
Yeah, it's different.
gets different RVUs based on what needs to be done. And obviously more complexes, more RVUs than some that aren't. But it's really about what we can do to make that environment better so they can see the number of patients they need to see, not us saying you have to see this many patients. I think that was something that was tried and didn't work very well. So the thing we're trying to do now is try to find out where the obstacles are so that we can clear those out to open up access. The RVU system will incentivize them to continue to open that access up. That's what, you know, the philosophy is behind it. So we are seeing some that are taking it a little more initiative to get those obstacles cleared. For example, Jay this time, all their providers really, we saw an uptick.
Well, that's
So-
the reason I'm asking this question, because I talked to a couple of providers, and they seem to think maybe the RVU system is going to work, and I thought, well, to me, it's saying they're seeing more for patient load than what the standard.
Yeah, it's
Okay.
not so much the patient load as it's standard. It's, like I said, getting the obstacles out, making sure that they have the staff around them that they need to be able to open that access up and be able to be as efficient as they can be.
Okay, well, I'm glad to hear they're taking advantage of it. Thank you. Thank you, Madam Chair.
Counselor Dobbins?
Dr. Jones, this may be a question for government relations. Do you know how the pending legislation on the $25,000 state income tax exemption for rural physicians, I know it passed the House 95-2. Have you heard?
We were just talking about that a few minutes before this. There's some requirements on population, you know.
25,000.
Yeah, and 25 miles circumference of that, or radius of that. So, you know, the thought is that we try to get some type of tribal exemption or waiver for that. Some of our clinics are going to fall in that, where we can offer that as a recruiting tool, but there are several of our clinics that will not because of proximity to Muskogee and things like that. So it's still in its infancy of knowing what it's going to look like in the final stages, and like I said, government relations is already looking for that. You know, typically in the past we've been able to get tribal waivers for stuff like that, so we're hoping that we can do that.
Yeah, that would be a heck of a recruiting tool.
Yeah.
We could get all our tribal doctors included in that legislation. Thank you, Dr. Jones.
Great.
Thank you. Any other questions here? I have just a few. Dr. Jones, can you tell me what are we doing right now for our Alzheimer's patients?
That I cannot tell you. I saw some questions on testing and things like that. I don't know the answer to that, and I was hoping Dr. Montgomery would be here today to answer that. But he's got the flu, so he's out today, but I will get an answer and get it back to you.
Thank you. One of my constituents actually had a wonderful idea, and I wanted to inquire about it, and it had to do with prescription mailings. Since we mail prescriptions to our patients, why can't we mail them all at the same time? Why can they, this person has a relative who receives several throughout the month. Why can we not go ahead and pre-fill it or whatever, so the script's good for, a month, and yet you're going to get a refill in 7 days. Why can't they go ahead and fix it for a month and 7 days if it's not a controlled drug?
I don't know the answer to that. I'll find out.
I just-
You're talking about bundling it up and
Yes,
then do
I
a
think it would
bundled
be a
rate?
huge cost containment measure for us in healthcare, in saving cost, in mailing, and even in time. I realize it would take some effort to get it started, but once that would get started, that would be a tremendous time savings for our pharmacists as well as for our patients.
And
I
it may
think the
be,
cost in the mailing would be-
I'm just talking off the cuff, but it could be that there's certain dates that trigger, depending on when that original prescription was filled, because there are restraints on, you can't fill a prescription within 30 days. It has to be 31 days on some things, and, there's time limits before you can
Right.
do that. So it could be some things like that, but, we can look into it and see.
I think that could be a tremendous savings all around for us. Another question. I want to go back to the dental appointments at 4:30. Why can they not answer the phone all day? Is it?
They should, but there's also, you got to keep in mind that in some of our clinics, like Hastings, we've got 2 front desk clerks that are our health specialists that are answering the phone. And there's typically 2 or 3 lines coming in, and you've got people coming to the windows. Part of it is the ergonomics of where we're at. logistics. We have 2 open windows, we have a space about as wide as 2 of these desks that 2 people sit in. A lot of that goes away when we get into the new clinic because we've designed that to be more friendly. But some of it's limited to space and how many people are calling and how many people are standing at the window, and sometimes those calls go over to the answering machine because you don't want to be standing there having a conversation and checking someone out and hold on, let me grab this phone, and you're ignoring the person at the window. So there's a little bit of a problem with supply and demand. It's during peak hours, during that time when people are calling, we do try to put more people on the phones, but even then, sometimes all the lines are busy and it rolls over into the answering machine. So it's just, more of a logistical problem than anything at this point, at Hastings anyway.
Okay, thank you for that. And then I had a constituent in Texas who wanted me to inquire, and I have to be honest, I don't remember if it was an eye appointment or a hearing appointment, but they said that they're not taking, the appointments are 1 year out. I'm stunned by that.
And I would say that is probably true. Audiology, we've got 1 audiologist, and we're going to be moving to, we've got plans for 3 in the new facility. But right now we have 1, and so that's 1 person seeing all those referrals coming in. And then as far as optometry, we contract with NSU for that. So they have their own policies and procedures that they work off of, and we have a limited amount of control over that.
Wow, well, I do hope those positions get filled rather quickly, because this was for a child.
Yeah, we already are recruiting for another audiologist now. That's one of those transitional positions that we've already identified that early on that we're going to be filling quickly.
Okay. Well, thank you so much. Does anyone have any further questions for Dr. Jones? I'm sorry, Councilor Critton, I think you were first.
Do you have anyone that it's their job to make appointments only, or are they doing other things?
Typically, you're talking about the dental appointments?
Yes.
So, so
the ones
typically we know, that's why we've set that time aside. We tried it early in the morning, we tried it at the end of the day, and it seems like end of the day has worked better for our patients. Early in the morning, people didn't like that because they were getting started on their job and they didn't want to. Anyway, we ran into different factors. We did surveys to find out what would be best. So typically we have the normal people that are at the front. We pull the office manager up. Sometimes we pull an assistant from the back to even answer phones if it's getting behind. But it's just, sometimes it's a matter of the phones. Sometimes it's a matter of you only have 2 lines coming in. So if that third person calls, it's automatically going to the answer machine. It doesn't even ring because someone's already on both those lines. So
we don't have just a job that their only job to take calls and appointments.
No. Yeah, our front desk people do that. I mean, they take phone calls, they do appointments, and they check people in. That's the 3 things they do. Yeah.
Right.
There are peak times when that gets a little bit busier than other times, and especially at the end of the day, and that's why we pull extra people in when we have the available phones to do that and roll those phones over.
I think it'd be a service because I'm like Harley. I get calls and letters. I think it'd be something to look at is, create a few more jobs just taking appointments, because I just happened to be on one. It was a teacher's assistant. Happened to be my little break time when the call-in time was. This was last year, and it was during the school hour, so I'm not sure if it was dental or another, but it was health. And it was like we were trying to win concert tickets. We had my phone, Miss Bynum's phone, or Reba's phone, and one of us finally won, So
Yeah.
I think it'd be a service to the folks if we could create somebody's job to answer that phone and, set their appointments up. Like, anybody?
Okay, Councilor Walkingstick. And just kind of FYI, y'all, we have 3 more committee reports today.
Okay. Hi, Dr. Jones. I know last month we were talking about the elder care and filling the position over there, and some of the information we got from the Attorney General's office with Chrissy she was discussing that there had not been a decision made yet in hiring for that position. And
Counselor Walking Stick, I think Elder Care is here to report today.
Oh, really? Okay, well, I'll hold my questions for elder care.
Yeah, and again, I don't oversee elder care, so that's not under the health.
Okay, I'll ask my questions in that report. Thank you, Dr. Jones.
Sure.
Thank you,
Okay.
Chair.
Any further questions? Yeah. Dr. Jones, thank you so much. Appreciate it. And now we're going to have a report from Pamela Eastman, Cherokee Nation Hospice. Hi, Pamela.
Hi, I'm actually April Moore.
You're April.
Yes.
I'm sorry.
I'm the administrator for Cherokee Nation Home Health, Hospice, and Outreach. So I'll be reporting on all of those today.
Okay. Will you be reporting in the future, April?
Yes, yes, ma'am.
Okay. Who was Pamela Eastman?
She is our director over home health. And I'm the administrator over the whole agency, over all of our different departments.
Okay. We'll get used to this, I'm sure. Okay.
So, thank you all for having us today. We're very excited about this. And in your package you should have, I did a little overview of each of our departments. So I'll just go over that and then at the end answer any questions that you may have. We've also brought some bags with some information for you all to take back to use as resources and things you can have as those questions arise, because I know you guys get those all the time. So Cherokee Nation Home Health, we have 3 different departments. I'm going to start first with our home health department. Our census as of 2/26 was 219 patients. We are a Medicare certified agency, home health agency. We cover 10 counties, and I've listed these out for you all. We do, with the home health, you have the 24/7 skilled nursing, wound cares, therapies. We offer the home health aid as well. We also accept Medicaid insurance and most private insurances as well. Moving on to our hospice department, the census as of 2/26 was 21. They're also Medicare certified. Medicare gives us a 50-mile radius from our Tahlequah office. Moving back up, the home health also has an office in Salina. Hospice is strictly out of Tahlequah. Hospice 24/7 nursing care also offers the therapy services, pharmacy, inpatient respite care, volunteer social worker, chaplain, bereavement. Hospice is a very rounded program. Our outreach department, it is our biggest department. Their census as of 6/26 was 608, or 2/26 was 687, and we call those, they're members on this program, not patients. It is a Medicaid-funded program by the Advantage waiver, so it's strictly state-funded. Because of the level of care with this program, we can cover a wider range, and so we actually cover 18 counties within this program. Consists of case management, skilled nursing, and personal care aides, or otherwise PCAs, which go in the home. And the program is designed to allow members that are at a nursing home level of care to remain in their home as long as possible. And so with these resources, these members can have their needs met by many different ways. At the bottom, I also listed our Native American employees. We have 106, with 90 of those being Cherokee. Our total all employees is 186. However, only 60 of those are full-time. The majority of our staff is part-time, and it is in that personal care aid department that is under the outreach department. Native Americans that we have serviced from October 1 to 12/31 of 18. In home health, we service 227 Native Americans, and in hospice, we have 30. I am working on getting the data from our state-funded program, but it's a little bit harder. It's more manual. It doesn't just run a report out of a system, so I'll be sure to have that, include that next time. So that's all I have. Is there any questions? Yes.
Counselor Ray.
Thank you, Madam Chairman. And you mentioned, you know, painted a broad brush quickly,
Yeah.
and I know you have. You mentioned 50-mile radius, and you mentioned 18 counties. What was the 18 counties that?
So that is in our outreach department, our Medicaid program, and the 18 counties that it covers, which is different than a home health, is Adair, Cherokee, Craig, Delaware, Haskell, Latimer, LaFleur, Lincoln, Mays, McIntosh, Muskogee, Okmulgee, Ottawa, Pittsburgh, Pottawatomie, I don't know how to say that correctly, Rogers, Sequoia, and Wagner.
And so few months ago, we had occasion in my family to call y'all and found that I was only told about the 50-mile radius. The other thing you just mentioned didn't take my jurisdiction in it either, and didn't take the north end, the entire Cherokee Nation. I don't know if you heard your counties mentioned, but I did not. And so here's, when we get into these situations with our elders, I've become acutely aware from personal experience that we're relatively limited here around the 50-mile radius.
Right.
How do we expand that?
Well, that's a Medicaid, because it's Medicaid funded, so that's a Medicaid regulation. So that would consist of opening new offices, through and being licensed if you were gonna fund it through Medicare.
Well, and I understand there are supposed to be hospices and elder care health and home health and the other communities, but they're full up. When you call, they're full up. And they're not oriented towards Cherokee citizens. And I can tell you that I've seen our elders go to the nursing homes, and when you go to a nursing home, you don't give up being Cherokee. You're still a Cherokee citizen.
Right.
But we don't get any help from you. And to be honest, you help our citizens, thank God, better than some of the other groups out away from Delaware.
Yes, sir.
And we know that. I mean, I've seen it in action, and I appreciate y'all. But we've got to one of these days, of course, we got our hands full now opening the 469,000 square foot clinic with needs for docs and nurses and I don't know what all else. But at some point in time, we're going to have to stop and take care of our elders. And I don't know when that starts, but we need to be thinking about it. I know you got a bunch of smart guys and gals where you're at. You seem to be one of them. And so we need to kind of get out there a little bit more, somehow, some way, if only for Cherokee citizens. I know you do also non-Indian.
Right, we do.
But at some point, we got to start taking care of these old folks. I'm getting ready to be one pretty quick. And I'm not there yet, so don't write me off. But I've seen us in my district, in my area, where I grew up, where I come from, do without when I see a really good system right here around Tahlequah. And so we call our representatives up there, which are your cousins, I guess you would call them, agencies, and they're full, or they can't do this and they can't do that. And here again, I'm gonna tell you, folks, when we go to the nursing home, we don't give up being Cherokee. And it's a little upsetting to me, especially when it happens to someone you know and you love, to realize they're out of luck. We got to send them to Tahlequah to live. I don't know how many times I've asked elders, do you have any kids or grandkids in Tahlequah? Because if you do, you might want to move there, because I know we do a good job down there. We don't do a good job in Nowata, and Bartlesville, and probably Veneta, and a whole bunch of other places. You guys, we're just left out.
Right.
And so, show me where one Cherokee is better than another. And someday, this council or this body, and I won't be here, but you got to take that stuff up. Some of you guys are going to be here for a while. We need to take that up. And you guys do a wonderful job here. And trust me, I've sent some of my people to Tahlequah.
Well, thank
They
you.
moved here
Thank you.
for the services they can get. And I was hesitant to do so because I think that we can do just as good in the 14 counties anywhere you live, but we don't. I don't know what they do around Jay or anywhere else, but we don't where I live. And we got to start taking care of these elders. We got a big job up here on the hill, staffing that clinic. I'm seeing, and I knew it would happen, and I told the chief it would happen, that we're starting to get notices in the newspaper for healthcare professionals to come to Tahlequah. Now, if my folks from my clinics can get a raise and a promotion, I'm all for it. But we're raiding our own clinics to send people to this one in Tahlequah because we don't know how to recruit, apparently. Somebody doesn't know how to recruit. And I'm looking for a young Barry Switzer type man or woman to go out there and get those young recruits in here for nurses, docs, whatever we need. And I don't see them. And I'm gonna say that now before this body, I don't see them. And so we need to start thinking about that. If the executive branch won't take care of it, then we need to talk to them. We need to run down the hall. Thank you.
Counselor Buzzard.
I want to go back to a little bit of how, you talked about funding a little bit ago and how these are startup. Is it funded strictly through Medicare?
Medicare, private insurance, and Medicaid.
The office in Salina, does that count as a 50-mile radius from
No.
the Tahlequah office?
Yeah, because it's just home health out of the Salina office, and
Okay.
so it covers those 10 counties. Yeah, hospice is
How
17.
would we go about getting funding for a station, say, in Benito? How would we go about funding,
Would
get
it,
that started?
would you be Medicare or would you be Cherokee Nation funded? How would you, what would be the idea?
So it could be, it could be funded either, Cherokee Nation could fund it at any place, really.
Uh-huh.
But the one in Tahlequah is funded through Medicare.
Yes, yes.
So how would we go about funding another one up further north through Medicare?
Just apply for a license, find a location. There is a process, and you do go, so long without getting paid, so that, the tribe would be able to help with the funding to get it started and off of the ground. But, I mean, it's very manageable and very doable, and I agree, we do need to look at those things. And I think I would be glad to sit down with you all at any time to go over.
Is there a reason we haven't expanded it?
I don't know.
My name is Matt Rucker. I'm the finance officer. At this time in our budget, like April had mentioned, is very... Sorry. My name is Matt Rucker, and I'm the finance officer. At this time in our budget, like April had mentioned, it is very costly to acquire NPI numbers. And unfortunately, we do not have the funding to go out and buy an existing agency up. And like she said, in order to establish a new agency, you have to go, I believe it's 6 months without billing any Medicare. And at this point, we could not staff it out of our current budget. So that is our main reserve.
April?
And I'm just echoing what Councilor Lay was saying, because we're hearing more and more from our elders about that type of care. And of course, I'm getting to that age too, and so it's important that we start looking at alternatives to do that, whether the nation has the money to do it, or even to go in and partner with Medicaid to do something like that. So I wish that you would do more exploring to see what some of those costs might be to get an agency further up north, because I feel like Councilor Lay, you'd have to move down here to get that care, which is good care. I'm happy about that, but we certainly need to spread it further up.
And we agree, and we would be happy to help in any way that we can.
I wish we'd look at a feasibility study and see what something like that would cost, especially on your part. And you said it had to run 6 months without billing those people.
That is if you try to go through and get a new NPI. There's a quicker way to do it is if you buy an existing NPI number, and that is what I would say most agencies do. But again, that's fairly costly, and we're a self-sufficient agency, so we don't have the funding for that at this time.
Just for clarification, because I don't think everyone... NPI means National Provider?
Yes, ma'am.
Okay.
Yes.
I'm not sure everyone here understands
So
what that is.
I apologize.
Can you get an estimate on what buying one of those would be?
Sure.
I'd be curious
We
to see
can look
what.
around and see, we can kind of get an average.
Thank you, Madam Chair.
Yes. Yes, just out of curiosity, April, have you got any estimate of how many elders we have in jurisdiction that are not receiving assistance that possibly need it?
I haven't, but I can. We can definitely do some research and pull some numbers of
I realize that's a very difficult thing to come up with, but if you could give us a projection at next quarter, a ballpark idea, I think we'd all be grateful to hear those figures. Any other questions for April? We've got another report after this. That was an excellent report, April.
All right.
Thank you.
Thank you all.
Okay, and then we have Pace, Thelma Pitt. Hi, Thelma, how are you?
Hi, good, Madam Chairman. Thank you for having me. I hope I can answer all your questions. I did put a report in your package. It was a fairly lengthy report trying to answer some of the questions that you asked Ms. Proctor the last time. I also brought a newsletter. We do this semi-annually, and we were projecting 170 census for March, but we have 169, of which 50% of those are native and 50% are non-native. We finally have reached our full capacity on employees. We have 67 as of March 1st. 72% of those are native, 63% of those are Cherokee citizens, and 28% are non-native. We are projecting 172 census for April. We had our Vanderbilt students here last week. They do an alternative spring break. They come every year. We had 10 this year. We were able to expose them to a Cherokee language class. We also took them to the Heritage Center, and we also took them to the Mural Home. And they enjoyed it very much. They worked with our participants and cleaned their yards and played bingo with them and all those kind of things. So the participants enjoyed that very much. We are, just to recap what I gave you in your report, we are a Medicare, Medicaid funded agency. We are standalone. We are self-funded through those. We receive no funds from the Cherokee Nation. We usually have more dual eligible folks, that is, people who are eligible for Medicare and Medicaid. We have some Medicaid only folks. We get our funding from the state through Oklahoma Health Care Authority and also through Medicare. The Medicare and also Part D. We are payers of last resort. Our participants have no copays. We take care of all of their medical and pharmaceutical needs.
I have a question.
Yes, ma'am.
You said you take care of all their needs in-house. So that means if you
No, not in-house.
In-house.
No, we have a clinic and an adult day health center, but if there is some need that they have, like inpatient, outpatient, radiology, whatever, we send those out. We have a contract we have several contracts. In fact, I know one of the questions that we had was something about the contracts, and we brought that contract list up to date. And if anyone needs one, we have it on our website that they can contact me, and I will provide that up-to-date contract list for them.
So you provide what's necessary for them, such as their medication,
Yes, ma'am.
and you also provide equipment or whatever might be.
BME, we provide everything for them. We function like an HMO. Our participants have no cost. We take care of all of that. There's no co-pays, nothing. The funds that we receive from Medicare and Medicaid, we put it in one big pot, so to speak, and we pay for all of their needs out of that.
Okay, any questions? Okay, Councilor Walkingstick, I think you were first.
Thank you. So, I need someone to walk me through this process of how we hired the director of elder care.
Well, that process was by the governing board. So those questions would have to be directed at them. I'm not HR councilman, so I couldn't really tell you that.
Thelma, are you the interim director?
No, ma'am. The interim director right now is Miss Connie Davis. I was interim director for almost a month, and the governing board decided to put her in as interim director.
If you don't mind. When was this made official, Thelma?
Councilman, it was last Tuesday.
Last Tuesday, okay.
That's when she took over. Now, as far as making it official by the governing board, I couldn't tell you that because I'm not privy to HR information.
Okay. So, a month ago, Tracy came and she addressed this council, and they were in the process of drawing up a contract, but they didn't know who the recipient was of this position. And she was unaware who was selected for the position from your governing board. But there was an email that was sent to the tribal council that had said that Connie Davis was the new director, the interim director over the elder care. So was you misinformed, or did they not communicate with you, Chrissy, on who the director was?
I don't know what email you're talking about, but
There was an email sent to all the employees at elder care saying that Connie Davis, the Thursday prior to you reporting to this body.
February the 14th is what the email, I have a copy here.
Okay.
I didn't have the
February
email, but
14th.
I know I went to the board meetings. They had 2, and I don't have the dates. I can get them. You guys can get them. You can request their minutes or their agendas, but after the meeting that you asked me about it, they had board meetings to discuss offering a contract to an interim executive director. So they may have had an idea of who that person was going to be, but it wasn't done. When I talked to you, a decision had not been made. Or at least the board had not voted at that point.
How did they not vote? And there was an email sent to
I don't know
the
anything
staff.
about the email, and I don't know who sent it.
Do you have the email that you could present to
Bree
us?
Long, I think, sent the email.
Oh, she's the HR director.
Yes. I believe it's, this email's from Bree Long.
Okay, thank you. So, on the 14th, it said, "Dear Pay Staff, I'm pleased to announce that Connie Davis, MSN RN, will join us next week as our interim program director. We are excited for her arrival, and I'm sure that everyone will make her feel at home here at our facility. Thank you." So, how are they sending this email out if the governing board had not decided who the director was?
Incorrectly.
Okay, so this employee was premature in sending this out?
Yes, because they're a board. They have to, the only way that they can take action is voting in meetings the way that you are. And again, I don't doubt that maybe there was some discussion, but it did not happen until, I can tell you the date,
If you will, please.
because it was after. I don't know. It was a Thursday, probably the 21st or the 28th.
Was that when the board decided on it?
I believe it was the 28th, but I just know it was a Thursday.
Okay. So, what really rubbed a lot of people the wrong way, because there was a lot of employees that had applied for this position, right? And they went through the process, and they didn't get it, whatever. But there was a preconceived notion that Connie was gonna get it, but you guys didn't know that she was gonna get it, and the board hadn't decided. But this employee over the elder care page just so happened to send an email out to all the staff saying, "You guys have a new director, Connie Davis." And and we visited in rules our last meeting discussing about employees having contracts and doing business with Cherokee Nation. And this particular employee has a contract with the tribe with a gas and oil.
No, she doesn't.
Yes, she does.
No, she doesn't.
Well, who does?
I've checked into it.
Who
She
does?
does not.
Who has the gas and oil lease with Cherokee Nation?
Her spouse, she is not an owner of that company.
That's a violation of ethics.
No, it's not,
Yes,
sir.
it is.
No, it's not. This has been an issue for years. An elected official.
Have you read the Sunshine Act?
I've read it.
have
We've written an
too.
AG opinion on it. We've been to court over it.
AG's opinion. You got an AG's opinion.
The law was changed to exclude the spouses of tribal counselors from contracting with the nation, and that excluded employment contracts. We have people all over this tribe whose spouses, who are not employees, own businesses that are separate from their spouses, and they can contract with the nation. It is not a violation of the Ethics Act.
So the intent of that law was to prevent employees of Cherokee Nation from getting money from double dipping, triple dipping, whatever you want to call it, from Cherokee Nation. That was the intent of it. But for us to give an attorney's opinion to say, well, it's okay for the spouse to get
It was
it.
not an AG, the law was changed in response to the AG's
When
opinion.
was the
This
law
council
changed?
changed the law,
When?
prohibiting, I don't know, 14 maybe?
Okay. So,
We said to the extent that the Sunshine Act allowed employees to contract with the nation, because that's what it used to say, that it was unconstitutional because the Constitution prohibits employees from contracting with the nation. As a result of that, this council changed the law and said that the spouse of a elected official, they didn't say anything about employees, spouses of elected officials cannot contract with the nation except if it's an employment contract. There are, I would guess, dozens, if not hundreds, of people who have a spouse who work at Cherokee Nation. They don't work here. They're Cherokee. They run a business, lawn mowing, office supply company, whatever it is. They are allowed to contract with the nation. Now, what they can't do is contract with the department where their spouse makes a decision. So I can't hire my husband's company to work at Cherokee Nation. But someone in health, he doesn't have a company, by the way, he's a firefighter. But someone in health could contract with my husband to buy a service from Cherokee Nation. And that is a standard practice and has been, there has never been a prohibition on a spouse of an employee contracting with the nation.
well, that's interesting, because, you know, all that money goes in the same household. But anyways, so I'm still a little bit concerned about this email, and then the AG's office not knowing, you guys are drawing a contract up, but not knowing who the individual was that was going to be selected.
Because no one had been selected. And I know Bree, and I assume if she sent that email, it was because someone had given her that information. She doesn't have the ability to make that decision.
Can you read through this piece of paper? How'd you know it was Bree?
You told me it was.
Did I said it was Bree
You
Long?
said Bree Long sent that email.
I was really, did I say that?
Actually, Chair did. Chair.
Someone said Bree Long, and
Okay,
I know Bree.
okay, gotcha. I was trying to protect your name.
Well, you said it first, not me.
I don't think I said it. But anyways, well, those are my concerns on this. And I feel like maybe you was misinformed, because I don't want to say you're dishonest.
No, what I'm telling you is regardless of what, I mean, people talk about who might be something, who might be in a position. She was not hired until the board voted to hire her, and I was there when the board voted to hire her, and it was after the meeting that we had. I don't know what information or what conversations occurred prior to that, but what I know is that Bree or anyone at Thelma, no one there has the ability to appoint an interim executive director except for the board, and that is not official until they vote on it in a meeting.
My question is who instructed this employee to send an all email out, a mass email to the staff?
I do not know. But
Tell me
again,
that-
I know
can
her,
you-
and I assume someone did, that she didn't dream
Who
that
was
up on her
over
own.
Bree?
The
The
director.
executive director who wasn't
The
there.
executive director, but
Which
the,
was Deb Proctor?
no.
I believe it was, well,
I was in.
Thelma was interim.
I was interim at that time, but I didn't instruct her to do that. It must have come
So
from,
did she just go on for her own? And
it must have
done
come
this?
from the board, Councilman. That's all I can assume. I don't
But she
know.
doesn't report to the board. She reports to you.
That's true, but I did not instruct her to send the email out.
That's all. I don't have any further questions.
I do have a couple of questions. Your time, I just want to share with you that, Thelma, that this lovely report, this 4-page report, it says that you were interim program director on February the 24th, which again is conflicting with the dates you're all giving us here. I will share that with you.
Okay.
I do have one question I would like answered today. When people are accepted into the program, is it explained to them, and maybe I'm wrong, their benefits? Somebody just recently pointed out to me that someone who perhaps you all may assist them with arm rails to help them go to the bathroom.
Yes.
But yet they may still need a wheelchair or something to go on the stool, and that they don't understand that they should go for the most expensive item first because Medicare is only going to pay for one. Is that correct?
Well, we have a physical therapy and occupational therapy on site that do assessments. And I don't know if they would go for the most expensive one first. We go for what they need and what the occupational therapist would say that they need. as far as handrails and so on, we install those and for any
So-
participant that needs them.
You're sharing with me that we would supply the handrails
Yes.
anyway? Okay, so if they need.
If they
which-
need them, yes, ma'am.
Okay, I guess my concern, Counselor Hatfield and I were talking with someone who had some background in this, that they would want to request the most expensive item first because they're only going to get one item from Medicare. But that's independent of elder care then, is that correct?
Yes, ma'am. I
Okay.
mean, we supply their need, and the occupational therapist and the physical therapist do an assessment and decide what kind of stool they need, what kind of handrails they need. And if it's the most expensive, we will supply the most expensive. If it's not necessary, then we supply what they need.
Okay, well, I'm glad they get what they need in our program, I really am. Counselor Crittenden, we're going to have to wrap this up, so make it quick. Okay. 2 more, okay, go.
All right, now, so can just anyone get the board minutes for?
Yes,
Just come and request the.
yes, sir.
They are subject to the
Open.
Cherokee, I told you last time, I think, open meetings, open record act.
From, I think it's business hours, you're more than welcome. Anyone can come and look at the minutes.
And also, I think we touched on this last time, but who appoints the board?
Chief confirmed by the council.
Yes.
I believe they're all chief, I don't think it's one where it's split. I think they're all appointed by chief and confirmed by the council.
That's what the legislative act says, states.
How long has this current board been on?
Yeah.
Members have come and gone. One of the board members has been there 2 years, I think. A couple of them have been there 5 or 6 years. Mr. Tadpole's been there probably 8 years. So,
But no one other than the chief appoints.
exactly. Yes, sir.
And council approves.
Yes, sir.
They have 5, I believe.
There's 5 board members.
You know, I'd like to bring this up in the future. I think perhaps tribal council should have some input on half that membership. Speaker Byrd and I were just talking about that. Do we need to make that?
They have to be affirmed by the council, by the general council also.
So it's created by legislative act, and as you all know, some things that there are board members for, council appoints some, chief appoints some, and sometimes even that group appoints more. But this one, the law as written was they were appointed by chief, confirmed by the council. So every one of them has come before the council for confirmation. So for the council to appoint, they would have to change the legislative act creating the
I wasn't done.
group.
Okay. It's Counselor Shambaugh's turn.
I really had the floor.
Oh, you haven't finished?
Mhm.
Okay.
But now, the interim position.
Yes, sir.
When are you looking to hire a permanent director?
Sir, I don't know. That's up to the governing board.
So there's no.
I don't
so
know
the
what their
board-
plans are.
The board would
Yes, sir.
decide when
Yes,
they're
sir.
going to hire permanent and, okay, thank you.
Counselor Shambau.
I'm just going to back up, and I'll just ask this to our AG. Should we not even be bringing up in open meeting a person's name? Shouldn't this be done?
We probably shouldn't have, but. Well, the question was who is the current interim director, I believe.
But it turned into something else.
I agree.
And it was mentioned, a name was mentioned that probably shouldn't have been mentioned in open meeting.
I agree.
That probably should have been done in executive, if it was going to happen at all.
Okay, if we should have taken that at executive session, I apologize for that. But since it was a mass email, I don't know. I mean, there's probably 30, 40 names on that email list. But we should have had a copy made available for you. I do have one question. There were 3 applicants for that director position, not interim, but director position at that time. Can you explain to me why, of these 3 applicants, no one was qualified for that position, or no one was selected?
That's definitely something we can't talk about. But again, this was not, the decision on who is the executive director of that organization is the board's decision.
Okay, can you share with us, since you did the contract on Ms. Davis, how long her contract is as interim director?
Probably not publicly. I think that you could request a copy of that under GRA, but when we're talking about the specifics of an employment contract, I'm not sure that that's appropriate for a public meeting.
Okay, you guys, we have another meeting after this. I'll take a motion to adjourn.
So moved.
Announcement, yes, Counselor Dobbins.
Reception for our medical school dean is this evening from 6 to 8. Obvious conflict with our council, but there is a reception for our medical school dean, 6 to 8 here in California. I can tell you where it is.
All those move to adjourn, say aye. Aye. Opposed, say